People have higher expectations of leaders in healthcare systems, physicians, nurses, to really drive more personalized care. You can't do that unless you understand the segments of people that you take care of. And that's really what we're driving to do, is to understand and create more patient segmentation so that we can deliver on that personalized care.
Hi, I'm Chris Malone, and I'll be your host for today's discussion. Before we begin, I would like to again welcome our friend, colleague, and program partner, Michael Giuliano. Michael is president of Planetree, which is a global not-for-profit organization dedicated to humanizing healthcare for everyone through excellence in person-centered care. And we're also pleased to announce that we'll be recording some bonus episodes of Humanizing Healthcare from the 2024 Planetree Forum in New Orleans on October 7th, 8th, and 9th. Michael, what else is on the agenda for the forum this year?
Thank you, Chris, and welcome everyone to this September episode of the Humanizing Healthcare. It's great to have you with us. And also, I'm looking forward to Patrick's discussion today, and also want to extend a thanks to our sponsor, Feedback Now. As Chris mentioned, we are really excited to have everyone arrive in New Orleans from the 6th to the 9th of October for our 25th annual Planetree Global Person-Centered Care Forum, where our very own Chris Malone will be speaking even further about warmth and competence and his book, The Human Brand, to attendees that are arriving from across the United States and from over 10 countries to discuss humanizing healthcare and how we can make a difference in this field. We will also be having 3 additional Humanizing Healthcare podcasts live, and also 5 other keynotes that we're really excited about from across the world, speaking about artificial intelligence, compassion, nursing, and a patient perspective to humanizing the healthcare experience. So thank you again to everyone who's joining. Looking forward to seeing you in person in New Orleans. And Chris, back to you.
Thank you, Michael. We are also pleased to welcome our sponsor, Steve Peltzman, CEO of Feedback Now. And if you've ever seen those happy and sad face buttons in the airport security line, retail, or a restroom, those may very well be from Feedback Now. And they're actually connected to a robust operations and data analytics network. This comprehensive solution takes real-time data from across healthcare operations and highlights where teams need to focus to improve patient experiences and reduce nurses' non-clinical workload. Welcome to the program, Steve. What can you tell us about our guest today?
Well, hello again. My name is Steve Peltzman. I'm the CEO of Feedback Now. We are proud to sponsor this Humanizing Healthcare discussion, and I'm honored to welcome Dr. Patrick McGill as our guest today. So just an intro, Dr. McGill serves as the Executive Vice President, Chief Transformation Officer at Community Health Network, based in Indianapolis. And with over 20 years experience in healthcare, he leads information technology, network analytics, clinical and nursing informatics, transformation services, patient experience analytics, business continuity management, and regulatory reporting. Prior to his CTO role, he served as the Chief Analytics Officer developing the Network Analytics Center of Excellence. And in addition, he has served as the Senior Vice President for Clinical Strategy and Vice President for Clinical Transformation. Dr. McGill has special interests in digital transformation, population health, value-based care, innovative payment models for healthcare, process automation, advanced clinical analytics, clinical decision support, workflow efficiency, and waste reduction. Under his leadership, Community Healthcare Network has received numerous awards and recognition. A few include being named to the Most Wired list in each of the last 3 years, and the 2020 Flywheel Award at the Health Analytics Summit. So welcome to the program, Dr. McGill.
Thank you. Thanks for having me.
Thanks very much, Steve. And welcome, Patrick. To get us started, is there a story you can share with us about how you chose a career in healthcare?
That's a great question. I'm often asked that question. I don't have of the kind of the heartwarming story of how I made it into healthcare. I originally wanted to pursue a different career. I wanted to be a pilot in the military, and couldn't fly because of my vision. So I thought that healthcare medicine was interesting and chose to go that path. I've had a lot of mentors along the way. My family doctor growing up was a mentor. And then while I was in medical school, I had some great attendings that really guided me down the path of primary care and ultimately, to become a family medicine physician.
Well, terrific. And so tell us a little bit about Community Health Network and your role as Chief Transformation Officer there. What does that encompass, and what are you guys focused on right now?
Yeah, Community Health Network is a mid-sized integrated health system based in Indianapolis, Indiana, mostly in central Indiana. area. We do everything across the board. Have one of the largest primary care networks. We're market leaders in women's care. Our North Hospital delivers the most babies of any hospital in the state of Indiana. Have a very robust oncology service line with we're one of the 6 MD Anderson partner members. We're very proud of that. Also market leaders in cardiovascular care and other services like behavioral health. The Chief Transformation Officer community is really designed, that role is really designed to bring together different areas within the organization to drive us forward. I often tell my team, if you're not waking up every day trying to think about ways we can make care better, make the experience better, make it more efficient, reduce costs, then you're not really transforming anything. And so that's the challenge. We need to come up with new ways of delivering care. And I know we're going to dive in a little bit more and talk about this, but it's really, how do you bring technology, experience, and that clinical delivery together to really deliver on our brand promise at Community Health Network of exceptional care simply delivered?
And so, as you mentioned, you originally joined the health network as a family medicine physician. And so how do you get from family medicine to physician to chief transformation officer? How did that all come about?
It's been kind of a winding path to get here. I came to Community Health Network. I was in a practice before, in a solo practice, and then joined the network in about 2010. And like you said, I was just a practicing physician. I was very busy. One of the busiest primary care physicians we had. I was the medical director of a couple nursing homes and doing that outside of my daily practice. And we installed, we're an Epic shop. We installed Epic in 2012. And I got involved on the informatics side because I wanted to make sure that this EMR installation that everybody had been talking about wasn't going to totally disrupt my workflow and the care of the patients that I was taking care of. So I got involved in the optimization side of that. That led to becoming a physician builder. That led to getting involved in clinical quality. That led to connection with our joint venture for population health and value-based care. That led to analytics. Just kind of all along the way, I've always taken the approach of always try and learn something new, expand what you know. And honestly, I hardly ever say no when somebody comes and says, hey, we think we need you to take on. So the Chief Transformation Officer role of the last couple of years has expanded to include other things like care in the home, geriatrics, palliative care, hospice, home care, as we really start to evolve how we deliver care, pushing more of that care to the home.
Well, that's really fantastic that you were involved at such an early stage, because you hear so many things about EMR implementations that do not take enough into consideration the physicians and the clinicians that have to use them and the impact it has on experience. Do you feel that because of your involvement that Community Health's implementation was significantly different than perhaps some other systems? And is it a little bit more clinician friendly in that regard?
Well, I would hope so. My involvement actually started after the implementation. I was not one of the physician champions. I got involved on the optimization after we installed it. And so I would hope to think that over the last 15 years, we've been able to optimize the system really from a clinical lens, not for just physicians, but also all of our nurses and medical assistants and APPs and other people, all the caregivers at Community that have to use the system. That's really our goal, is to how do we make it better for the end user, for the patients, for the experience across the board.
Now, I saw that Community Health Network recently announced some new technology initiatives relative to the Microsoft Cloud and Qualtrics participating in the Epic workshop. I was wondering if you could tell us more about those and if there are any impacts that you expect those to have on patient experiences and outcomes.
Yeah, we've really taken those projects are really focused again on how do we optimize the care of the patient. So we in 2023 implemented Microsoft Dynamics 365 for our contact center and our marketing to really understand and continue to understand that patient journey, delivering more personalized care. We have a long-standing partnership with Qualtrics that has then expanded into this partnership that Qualtrics has with Epic about how do we understand that patient journey? How do we understand the friction points? How do we understand what people are going through so that we can, again, understand and make it better? I often say, for years and years in healthcare, we've had one segment, and that's been called the patient. And I think in 2024, as we move into 2025, people have higher expectations of us, of leaders in healthcare, of healthcare systems, physicians, nurses, to really drive more personalized care. And so you can't do that unless you understand the segments of people that you take care of. And that's really what we're driving to do, is to understand and create more patient segmentation so that we can deliver on that personalized care.
You make a great point. It really leads into my next question, and that's related to relationships and personalization. So, kind of one of the basic premises of our program is that as healthcare organizations have become larger and more digital and focused on efficiency and cost, care experiences in some cases have become more kind of transactional and impersonal and disengaged, not only for patients, but also for clinicians. And so, this transformation and personalization, I wonder, perhaps that personalization is one of the things that can lend itself to more of a relational approach where patients and clinicians have the time to kind of have a more of a relationship with one another over time. How do you think those things may fit together or not?
So, at the foundation of healthcare, it's still people taking care of people. We can talk about all the different EMRs or technologies or this, but at the end of the day, it's still humans taking care of humans. And I think we often sometimes forget that. And so, what we really strive for in transformation is, how do we put that human relationship, whether it's in the exam room or a pharmacist with patients or whatever that might be, how do we put that back in the center and allow people to do the things that they have a passion for, taking care of people, the things that they've been trained to do? I'm over the cliche of kind of work at the top of your license, because I think that's different than what we're talking about. We're really talking about, how do people take care of people, understand their needs, understand what their drivers of health and well-being are. How do we really put that back in the center of what we're doing? And in some ways, the pandemic helped that. Some ways, the pandemic hurt that. And I think that that's what our role as leaders is, to really set that vision and strive to push the organization forward. So we're really excited about a lot of the work that we're doing. I think it is exciting. I think we have great outcomes of what we've been able to achieve, but we have a lot more work to do.
Given your experience as a practicing family medicine physician, there's a lot of data already that shows that relationships matter to patients. The stronger the relationship they have, they stay engaged with their care, they have better outcomes. Not as much has been looked at in terms of, well, what is the meaning of that relationship to the clinician? And does that play a role in their well-being and avoiding burnout and things of that nature? What's your take on that, given your own personal experience and what you've observed? Do those relationships with patients matter to clinicians as much as they seem to matter to patients?
Oh, 100%. So I still practice. I still see patients one day a week. And that's very important to me, that I still do what I love to do, what I've been trained to do. And I have a duty and a responsibility to the people that I've taken care of. Many of these patients I've taken care of for 20 years. I've taken care of their parents. I've taken care of their children. I've taken care of them through many different things, through cancer, through having babies, through heart attacks, and all these other conditions that people have. And that relationship that you build, I would say, it's really the trust that you build is at the heart of that. And I think sometimes we lose that. When you just create a bunch of transactions, you don't have any trust. Actually, and a lot of times you can create quite the opposite, a lot of mistrust, because it's just a transaction. But I think when you really build upon that relationship, it's something that's different, something that's special. And so, yes, I think from a clinician standpoint, those relationships matter. People always ask, well, you're in administration now. Must be easy because you don't have to see patients all the time. And it's like, I love my Mondays in clinic. It makes it real for what we're trying to do in transformation and what we're trying to do with technology. But that's what gives you that joy and that excitement about to see the impact. And I think as a leader, it gives me a lot of credibility because I'm going through a lot of the things that we're asking our other clinicians to do. Use a technology, pilot a new partnership. Those things often start with me. And I think that's important for me as a leader to model that behavior, that it's so important.
That's an excellent point. And I think to your earlier point about personalization, that's really where relationships begin, right? So if we can enable clinicians to have the information and the time and the resources to make that connection, the degree to which we're able to personalize that interaction, that's the evidence that we have a relationship, right? Versus if we're asking the same questions over and over and over again, despite how many times we see folks, that's kind of more of a transactional approach.
I've moved practices twice in my career with community for a couple of reasons. I've actually moved twice over my career. And now as I've cut back to one day a week, I have patients who we've tried to say, hey, I'm only there one day a week and you drive an hour to come see me. Let me get you connected with somebody who's more available to you, closer to your home. And so we'll send them a letter with options. And these patients will come in angry about what are you trying to do? I said, I'm only here on Mondays. I'm trying to make things easier for you. They're like, I don't care. I'm coming. I'll drive the hour. I mean, I think when you have those types of conversations, interactions, it really reinforces what you're trying to achieve.
Absolutely. Now let's take a short break, and I'd like to hear a little bit more about Feedback Now. They're doing some interesting things. Let me show you some of them.
Ready to revolutionize patient care? Real-time operations can transform healthcare's human aspect. Feedback Now's comprehensive solution uses instant data from across your operation to highlight where teams should focus for faster patient service, reduced staff burnout, better noise management, cleaner public facilities, and more. From parking to discharge, every touchpoint can be optimized in real time. Join healthcare leaders creating wow moments with personalized care. The future of healthcare is here. Don't be left behind.
Back to our conversation. What are some of the recent or current transformation projects you have underway at Community Health Network? Is there anything you can share with us, in terms of how that's going and what you're learning?
Yeah, that's a great question. I'm not sure we have enough time today to cover all of them. So I'll give you a couple of highlights I think that are really important. We've spent a lot of time, energy, and effort in transforming access and how patients are scheduled through online scheduling and some of our partnerships with tech companies like DexCare to really grab the patient when they're searching for care and help them through the journey to get them scheduled for care. And we've had great success with that. We've had a lot of success with ambient documentation. I think it goes back to what we've been talking. We have an excellent partnership with Nuance, which is part of Microsoft now. And that has really allowed clinicians, physicians, and providers to go back to really delivering that personalized care because it's taken time off of the keyboard and allowed them to really focus on the patient. And the feedback that we get from that, we've been doing that about a year, is incredible. You hear that across the board. I really feel like that ambient listening, ambient documentation is probably one of the most transformative technologies that we've implemented in the last decade. We also have an emerging partnership with a company called Lirio that does precision nudging. So going back to that personalization of how do we connect people with where they are to really get them the services that they need or the access that they need, et cetera. So those are just a few. I mean, we could go on. We have dozens more about really how do you deliver personalized care and leverage technology to allow people to do what they're trained to do.
Tell us a little bit more about that nudging initiative that you mentioned. Is that through text messaging or how does that work?
Yeah, it's going to be through text messaging, through MyChart messaging, through email. It's really creating personalized messages because we would all get care or not get care for different reasons. So think about other examples in your life that you get personalized care. Netflix, for example. If we all logged into Netflix right now, we would have different recommendations for what we watch based on what we have watched. And it's the same concept with healthcare. We just never really taken this approach in healthcare. It's just, again, it goes back to we've had one segment. It's called the patient. You get one message and you get one explanation. I think, how do we use technology to make that more personalized? And that's really the vision that we have.
Now, I understand under the transformation umbrella that you also address value-based care. And as your organization moves towards value-based care arrangements, what are you learning about kind of the patient experience and provider satisfaction? What role do they play in making those contracts achieve their intention?
Well, to be successful in value-based care, it does take a village. I know that's a cliche. We've been in the value-based care space for a long time. We've been in the direct-to-employer space for the last couple of years, had a lot of success there. We've had a lot of success with value-based care. And I think it goes back to how do you engage people where they are with addressing the needs that they have, whether it's social determinants of health or medication affordability or gaps in literacy and understanding of what's entailed in their care. I think it's meeting people where they are to drive success in value-based care. Certainly, there's a cost control, cost containment, appropriate level of care, whether it's connecting to primary care or avoiding the ER unnecessarily or avoiding readmissions, all of those things that we're all working on, that we've been working on for years. But really, how do you go upstream and connect to that wellness and the patient needs and the gaps that they might have? We've had a lot of success. We've really focused a lot in the Medicare value-based care space, but we've had success in the commercial space as well. And like I said, the last couple of years, we have a direct-to-employer contract that I'm very proud of, that we've been able to deliver premium reductions to this partner for 3 years in a row. Wow. I want you to think about that when you hear about the news and insurance premiums going up 8, 10, 12% year over year. we've been able to deliver premium reductions for 3 years, and that's basically unheard of.
It sounds like Community Health Network has really been an innovator, not only in technology initiatives, but also in value-based care arrangements. For a system that is relatively smaller than some of the larger ones, some might say, gosh, where do the resources come from? So many systems are challenged with resources. Is there something different that you're able to do to kind of be able to be such a thought leader and so innovative given your size?
I have that same conversation very frequently, and it's hard to imagine that $3.5 billion is a relatively small system in healthcare these days. I mean, that's mind-blowing to think that, but it's true. It is true. So we often talk about what do we bring to the table that some of the bigger systems can't. Well, we're organized to be nimble, innovative, and think differently. Goes back to how we've organized transformation, how we've organized some of our other partnerships. We see the world differently, and we really focus on this experience, delivering experience, whether it's a patient, caregiver, whatever that might be, and how do you use technology? We don't have a huge investment fund where we're making bets on different technologies. What we bring to the table is a learning sandbox that technology companies can come in and solve the problems that we are having. So we bring an engaged workforce and an engaged system and a learning. They bring technology expertise that we can't compete with the larger systems to gain and maintain. I think we bring a culture of learning and innovative thinking and other mindsets to the table to really drive that change. And I often tell people, if you can solve the problems that we are trying to solve at Community Health Network, you can translate that to 95% of the other systems in the country, because care is delivered at places like us, community-based health systems. And oftentimes that's what it takes. It takes a different mindset, different conversation. And again, the way we're organized, we can move some of those barriers out of the way to really achieve what we want. But yes, you're right. We have made investments. When you look at our tech stack and some of our other investments, we have made investments, and I'm very proud of that. But I think it's really our relationships, our culture, and our partnerships that have driven a lot of the innovation and transformation change. And that all goes back to our caregivers. We have 16,000 amazing caregivers that wake up every day to deliver the best care that they can.
Well, that's fantastic. So for others who are listening, what advice would you offer to other healthcare leaders that may be considering technology transformation, kind of projects and initiatives? Given your experience thus far, are there any insights or key takeaways or suggestions or rules of thumb or watchouts even that you might offer?
Yeah, one of the things I often talk to people about is, and I read a very interesting book a couple of years ago. It's called Same as Ever by Morgan Housel. I don't know if you've ever read it.
Okay.
He's written a couple of books. So what the advice that I give people from that book is, healthcare is changing, and the book talks about focus on the things that don't change. We're always trying to predict what the next change is. What's the next thing coming down the line? What's the next innovation? It's that old adage, you got to skate where the puck is going. I would offer a different thing. Focus on the things that don't change in healthcare. Human relationships have not changed in the last 200 years in healthcare. People taking care of people. Meeting people where they are and addressing some of their needs has not changed. We may have changed how we address that or the tools that we use, but that human-centered care has not changed. And I think sometimes we get so focused on trying to drive change or look at things that are changing that we forget, let's focus on the things that aren't changing as a way to mitigate a lot of the change that has occurred. And I think when you put it through that lens, it gives you a very different perspective on how to address some of the problems. And I'm not saying don't change. That's not what I'm saying. What I'm saying is, if you start with the things that are foundational, you can be better prepared for the things that are changing.
I think that's great insight. Great insight. Because as much as the technology changes, the way our brains were wired to interact with each other hasn't changed in thousands of years and isn't going to change in our lifetime. And so making sure those two things are compatible is really important.
At the end of the day, as a primary care doctor, I still take care of people. I diagnose their problems. I write prescriptions or I make a referral. That core fundamental thing has not changed in 50 years. I write a prescription differently than how I did when I finished my residency. Everything was on paper and now it's electronic. But I'm still at the core. I'm giving medications to treat problems. And I think if you distill things down like that and then layer on some of the tools to use to drive change. How do we do it differently? I think it does give you a different perspective.
Absolutely. So let's take a few questions. We do have a question from Geraldine D. Hi there. I work at Community Health Network on the Transformation Services team. When thinking about keeping the relationship with the patient at the center of what we do, how do we integrate that with the emerging technology and AI capabilities? How can these same innovations help move the health equity needle as well?
Well, I appreciate the question from Geraldine. I know her personally. She's an amazing caregiver. To answer that question, health equity is also rolls up through transformation.
Mm-hmm.
So when you think about what we've just been talking about, oftentimes a lot of health systems put health equity off to the side. And what we've really argued and advocated is that addressing health disparities should be core to what we do. And again, meeting people where they are, meeting their needs. And so how do you address that? And how do you keep a lens on health equity so that as you implement more and more technology, you're not leaving some people out? And I think that's what we have to be able to do. And it goes back to what I was just saying. Focus on some of the things that don't change so that you can then create these wraparound services to address some of the change. But health equity is something that's near and dear to me personally. And that's why I felt very strongly that it should stay in transformation. So to answer her question, it goes back to some of that segmentation. And so and I'm not just talking about technology, but how do you understand people where they're coming from, whether that's their background or culture or whatever it might be, so that we can better understand the care that we have to deliver. So I was actually involved in a back and forth question this morning with part of my area that I oversee is our brand experience. So as we send out brand surveys of what is the Community Health Network brand, one of the things that we have not asked is what is the language that's preferred to speak in the home of the person that's answering this brand question to give us the perception. So we want to start to understand how is our brand perceived by people who don't speak English as a second language, or English is not their predominant language. And I think it's starting to drill down into questions like that will help us design processes to address some of those health equity gaps. One of the things I'm very proud of, we have an incredible patient experience score. So if you look at the patients who receive care at Community, on a 5-point scale, 95% of them, 94.5% of them give us a 4 or a 5 on the 5-point scale of overall experience. And that's across the board. Inpatient, outpatient, ER, behavioral health, primary care, whatever it is, 94.5% give us a 4 or 5. But when you start to segment that down into certain populations, the score drops off dramatically. And we have to do something to address that. And I think that goes back to understanding the different segments so that we can design processes or interventions to address those disparities.
I think it's an excellent point. It's exactly what I was thinking as you were describing. It was all about personalization and the degree to which we have a one-size-fits-all process for things. There are those who will be served well by that, and there will be those that are not served well by it. And our work has shown that we're kind of getting an overrepresented voice from the people who are served well by that, and those that are not served well by it don't even bother to reply in many cases. And so we're really missing a big chunk of the picture of what's really happening.
That's 100% true. And so one of the things that we've started to understand, because I think if people always ask, well, what keeps you up at night? There's a lot of things that keep me up at night. But one of the things that keeps me up, related to the conversation we were just having, is we call it the winners. We always survey the winners, people who had an appointment. But what about the people who didn't get an appointment or couldn't schedule an appointment because it was in a language that they didn't understand, or they don't feel safe coming into the environment? How do we understand what their needs are? And I think that's where it starts with some of this brand work. But we've started surveying people who drop off and don't make an appointment so that we can understand, why did you not schedule the appointment, or why did you not schedule the test? Help us understand, because you're right. We tend to survey or over-survey what we would call the winners. We don't survey the people who are not seeking care or have not received care for whatever reason it might be.
Absolutely true. So I've got a final question for you. Do you have a favorite quote you can share? And if so, why is your favorite quote?
I have a couple favorite quotes. One I often tell myself, because I hold myself to very high standards, and so therefore I hold my team to very high standards. But I love this quote from Seneca, who was one of the great Stoic philosophers back in the day. You probably don't get these types of quotes on your podcast very often, and I hope that that's one of the things that's going to make this different. But one of the quotes that I love from Seneca is, "We suffer more in our imagination than we do in reality." And so if you think about that as a leader, I'm very hard on myself because I want excellent outcomes and I want to deliver excellent experiences to the people that we serve and everything else. And so a lot of times we're overly hard on ourselves when something doesn't go right. But at the end of the day, we're still humans taking care of humans. We're still humans leading humans. And I often tell myself, don't be so hard on yourself. When you make a mistake, use it as a learning, use it as an opportunity to get better. Because again, we often suffer more in our imagination than we do in reality. People have a totally different. And then the second quote that I often give people is from Mother Teresa. And it's really, if you help one person at a time, start with the person that's closest to you. And I think that, again, based on our conversation, when you think about that, when I'm in the exam room, I'm taking care of one person. When I'm a leader, I try and take care of, obviously, the policies and the things that we do, the implementations are going to impact thousands or hundreds of thousands of people. But part of the reason that I really love still seeing patients is I'm able to take care of that person in need one-on-one at many times when they're the most vulnerable. So really, if you think about trying to make change and drive change and transformation, just start with the person that's in front of you or the person that's next to you, and that will start to spread.
Great advice. Thank you so much for talking with us today. It's been a great discussion, and I really think our listeners have learned a lot about Community Health Network. For those that might be interested in following what you're doing in the future, what's happening in Community Health Network, what's the best way for them to keep up with your work?
Probably through LinkedIn. I mean, we obviously do the typical channels, but if you follow me on LinkedIn, that's probably the best way. I typically am posting new partnerships or new innovations or other things that we're doing. Or just like I said, there's 16,000 people at Community that are doing this work. It's not just me. I have the pleasure of being a leader, but really follow Community Health Network. I really do think that there's a lot that's going on at Community that you may be surprised about.
Great. Listeners, thank you for joining us today as well. We hope you found this discussion informative and inspiring. I'd also like to thank good folks at Feedback Now for sponsoring our program today. And be sure to join us for our next Humanizing Healthcare discussion. We'll be talking with Rick Evans, Chief Experience Officer at New York Presbyterian Health. You won't want to miss it. Thanks very much, everyone.